Staying with the health sector now, because 9 people are now currently in mandatory self-quarantine after traveling to Ebola-affected countries in the last 21 days. Dr. Christopher Tufton says the travelers have shown no symptoms of Ebola, and the medical team say there is no risk to the other passengers on board the flights.
Ministry can confirm that 9 passengers from several flights into the country had a travel history associated with the affected countries. These individuals had received counseling from the airport help desk, placed under mandatory self-quarantine, and are being monitored by the respective health departments. Importantly, all 9 passengers have not manifested any symptoms associated with Ebola.
Dr. Tufton says while Jamaica remains low risk for Ebola, there is heightened surveillance at the ports of entry. At the cruise ship terminals, for example, he says the intensity of the interrogation for visitors may be increased, as well as the visibility of other healthcare workers.
So the risk to Jamaica remains low. The scale and trajectory of the outbreak warrants enhanced preparedness measures in accordance with our WHO recommendation for countries assessed as having low risk of importation. So in keeping with the WHO temporary recommendation issued to countries at low risk, we have intensified preparedness activities aimed at ensuring the early detection, reporting, and safe management of any potentially imported cases.